Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And today's guest is Linda Stevenson. She's CIO at Fisher-Titus Medical Center. Welcome, Linda.
Hey, nice to be here.
Yeah, so excited for this discussion about telehealth and all the things we've learned and, the battle scars. Is that what it is? After implementing it so quickly. But
Yes.
we've all been through something, right? Before we dive into that, tell us a little bit about yourself and Fisher-Titus Medical Center.
Sure. My name is Linda Stevenson, and I've been with Fisher-Titus for about 3.5 years now. Fisher-Titus is a rural hospital located in Northwest Ohio. So we're about 20 minutes south of Cedar Point, if anybody knows, the biggest roller coaster capital of the country. So
yeah, we all need to go there now.
Right. It's a great place. So we're lucky to be out in that area. We have about 99 beds in our hospital. We have 50 to 70 providers, and then we have a full suite of everything from birth to death, including our OB program, all the way to senior living, a nursing home health, post-acute services. So we really cover the gamut for bringing our patients everything across the span of their life right here in our rural area.
Wow, that sounds like an overachiever. But I guess you have no choice. Maybe in the rural environment, you have to be all things to everyone. Is that
That is correct.
Amazing. So, talk about what was your original approach to telehealth, and what did you maybe learn from that initial effort that I think we all, kind of threw together?
Yeah. Well, I was really blessed in that I had already started down the path when I got here. I got here in 2019 and knew that we need to really look at telehealth as a solution and an offering, knowing that I would go into this with a painful glaze from the physicians, knowing they don't want to do it. But I had already begun to look at systems and where we can go with that, looking at vetting vendors, and then COVID hit.
Yeah.
And pretty much all bets were off. We had to do telehealth or there was no way to see the patients. So what did we have at our disposal? At that time, we had luckily just implemented Microsoft 365.
Okay.
And so therefore Teams was part of what we did every day, which was great. They were getting used to it. They didn't like it, but we were doing it. And we thought, okay, well, we can use Teams because we know that offers a video and we can get a bunch of iPads. So that's exactly what we did. We rolled out in 5 days. Set up all of our providers with Teams accounts. All of our providers had their own iPads and defaulted the image on the iPads to make sure it was easy for them to get to set up and log into Teams and then get the patient to connect to Teams. So it was a whirlwind. Lesson learned, we had to do what we had to do, but what we didn't know is that the connectivity in the areas of the rural areas that we live in were not robust enough to handle even the iPad solution. So it was not without its pain, but we got the job done and we saw our patients.
Well, it's amazing all that, complaints from the doctors disappeared. I like to say the value equation changed for the doctor when it came to telehealth.
Absolutely. New complaint, but the complaint was no longer about, I have to do telehealth. The complaint was really how the telehealth worked.
Yeah. So talk about that. You had this experience that, you made do we had to, right? Then you decided to work with Oracle Cerner and with Amwell to implement more of a longer term telehealth solution. So talk about that experience and the transition.
Sure. Well, like I said, I had already been looking at the vendors, and to me, the vendor that made the most sense was Amwell because of the integration with Cerner.
Yeah.
My approach to everything we offer our clinicians is to make it seamless and make it as simple as possible. And to have a separate solution that they had to log into and document in different places did not make sense. So we were already looking at that contract. We contracted as soon as quickly as possible with Amwell, and went down that path to implement the integrated Amwell. I know a lot of places at that time really had Amwell up and live, but not with the integration with their EMR. So that was really a big differentiation there.
So talk about that integration. What does that involve? What does the workflow look like, documentation, et cetera?
Sure. So the connection for our physicians to connect to the patient is through the Cerner app. Initially, it actually had some deficiencies, let's call it, because really we hadn't thought through what that integration could look like, what the ultimate goal is. So doctors document in one place and can link out to the visit with the patient, which would come up on another screen at that time. Since working with Amwell, Amwell and Oracle Cerner, everybody got together and said, okay, what's really the best way to do this? And the best way was the picture-in-picture, which they helped to implement, so that as the doctor's looking at the screen, seeing their patient, they're not distracted on another screen doing their documentation. So everything's right there. And it's not requiring multiple monitors if we don't want it. And it just keeps it as simple as possible.
It's amazing how just the simplest solutions make the biggest difference, right? It sounds like that's what your doctor's experience is like. Well, we could put another screen, but the picture-in-picture is just a better experience. Is that what you found with them?
Yes, absolutely. I think the other piece that we learned was when a patient comes into a physical office, they're greeted by someone at the front desk, and that front desk will take some basic information. They get you all ready. They tell you it's time to go back and see the doctor. Then the doctor sees you. So they're coordinating that process and that path the patient's taking. That really wasn't available to us when we first started down the integration path with Amwell and Oracle Cerner. So we worked with them on that, and we call it the warm handoff. So now the MA or the registrar, whoever's at the front desk, will take the patient's information. They know that there's an appointment. They call and reach out to the patient. They log in and they connect with the patient online first, just like as if they're walking up to the window. They take information, they prepare the chart, and then they put the patient in a waiting area for the physician to log in and grab it, and it transfers to that physician's device. So it's almost as if they're in the room.
I mean, I think what's amazing about that, and I did a whole series of EHR telehealth integrations and their approach and what the EHR vendors were doing. And I was so fascinated that no one did what you just described, right? Like no one had. And yet you're like, okay, so did we just make the doctor the MA and the front desk as well, if they're going to do the intake? And so then, that was my question, was like, does that intake not matter, or are we just having the doctor work as an MA in the intake? It sounds like you saw the latter and needed to fix it.
Yeah, we absolutely felt the same way. The physicians would have been very frustrated with that scenario. And I think it does the patients a disservice, especially if in a rural area, as I mentioned, sometimes there's connectivity issues, and those things can be worked through with the front desk person before the doctor's spending the next half hour trying to figure it out, right?
Yeah, you don't want the doctor as the tech specialist.
Right. God forbid, right? They have their role and we have ours, and let's leave it at that. But the other important thing was, let's say the doctor's running behind. That doesn't happen in healthcare, right? But it really happens all the time.
Yeah.
So if they're behind and the other patient's waiting for their visit on telehealth and they're wondering what's going on, no one's on there having that conversation with them to say, oh, doctor's about 30 minutes behind. We're gonna get you in as soon as possible virtually. Where the MA now can manage that themselves. They can contact the patient and say, hey, we're running a little behind. We will reach out to you as soon as he's ready. So be standing by your phone.
Yeah. Well, I think it's interesting that as you describe it, the virtual visit workflow compares the same as an in-person visit. Is that true from the scheduling? It's true from the intake. It's true from adding the doctor. Was that the goal?
Yes, that was the goal for sure. Yeah. Now, I know there's circumstances where you don't want that full experience, for example, a convenient care or urgent care type of visit. And we do have some of that occurs that may be handled a little bit differently, where the doctor is doing more quick intake stuff. But for the most part, let's make it as seamless as possible. Let's make it feel like the patient's really here.
So where are you at today as far as adoption of telehealth? Like, and maybe you don't need a number necessarily, but, like, are people going back to the regular visits, or your doctors have accepted that certain visits are better in telehealth? And, in the rural, you often have to travel long distances. So are they embracing it, or are they kind of saying, let's go back to the office visit?
I think it's truly a mixed bag at our organization, because we're in a rural hospital area or rural area. The patients love their doctors. They like to see people. That might be their outing for the day with the kids to the pediatrician, who knows. But so we do have a lot of people going back to the in-person visits because they like it, and because our doctors, fortunately, are easy to get in to see. It's not like they're struggling with appointments. If that were the case, we might see more of that telehealth spike. But there are some doctors who have certainly seen the benefit of, hey, it's way quicker for me to just do a quick telehealth visit, let's say a post-surgical visit or something like that.
Right.
rather than have them drive all the way in after that situation. So it is a mixed bag. We're at about 8% adoption. It's a little lower than I would like, to be honest, but our patients are happy and they're being seen the way they want to be seen. So they have options.
Yeah, and I think that's the key at the end of the day is what does the patient want? To your point, sometimes it's their neighbor. They want to go see their friend, right? Like,
absolutely.
In rural.
Absolutely. Yes.
Yeah. Interesting. So what would you say is next on your telehealth roadmap? What are you working on? What excites you as you kind of continue to push this forward?
Yeah, we're looking at a couple of things. We're looking at remote monitoring. So that would be obviously part of the telehealth space for our CHF and our diabetes patients out here in rural America. Diabetes is a huge problem. So really trying to get to the point where we can monitor patients from their homes and incorporate telehealth in that way. We're also embarking on school telehealth. So this child comes down with a sore throat in the middle of school. They go to see the school nurse. School nurse can only do so much because they're
Right.
Nursing licensure. So they can log into our organization as a physician school telehealth support program and have that physician see the patient right there in the visit. Now we got to work through the negotiation of, does the parent have to be there? How does the parent get that permission? All of that logistics, but really exciting opportunity to help the schools take care of the patients and students, and then get them home when appropriate or not.
Right. Or to do a better assessment. As someone who has 4 kids, I've been through that a lot. So that would be way better than, I think there's, the parents love the nurses, but understand that they have limited options, right? As far as what they can do.
And then sometimes it'll end up with the student getting their issues addressed much more quickly than if they have to go home, call a doctor and get another visit scheduled somewhere along the way. Yeah.
The remote patient monitoring that you mentioned, the RPM is interesting. I find it interesting that you mentioned diabetes. I think that's the challenge that most face with RPM right now is there's a diabetes one, there's a cardiology, cardiac one, there's one for each clinical specialty. Is that one of the challenges you see, or you're kind of waiting for it to mature, or how are you approaching the fact that there's 30 solutions for 30 different, conditions?
We're only looking at vendors that will allow us to do all of those things. So, because most patients who have diabetes probably also have some chronic heart failure or other morbidities. So we're only looking at those vendors that allow us to do kits and bundles of things that we can manage them as a whole.
Interesting.
There is a few out there.
Yeah, it's going to be interesting to see how that evolves. I think we're still at the early days, even with sensors and wearables and things like that will help us to manage it remotely. So it's the start of a fun adventure.
It is exciting. Totally exciting for our chronic care management team to be able to do so much more for the patients. As you know, a lot of our reimbursements now dependent on the health of our population. And when we don't have any insight into what's going on with them, that creates a problem.
Yeah. Well, and I think that's particularly true in the rural environment, although everyone's moving to more value-based care.
Yeah, totally.
So, as you look at your work in telehealth, we always like to wrap up the CIO podcast with a little career advice. So what career advice would you have for any others maybe interested in the telehealth space?
Sure. I think that the advice I'm going to recommend is probably regardless of what space you're in, but it's particularly important in telehealth. And the first one is involve your experts, right? I am not the expert in everything. I'm not the expert in connectivity, on the iPads, on all the solutions, on the workflows, all of that. So I need to involve my experts. I really need to depend on my team and the support team of the departments I work with to give me their expert ideas, to innovate and come up with new ideas that we didn't think of. Look at COVID. My team did that in 5 days, that they just all sat around the table, and I need to depend on them for that and give them and embrace that opportunity to do so.
Wow.
Yeah. The other thing is partner with your vendors. I can't do these things without the trust of Amwell and the working with Oracle Cerner together. All of us have to come together. It's like a triad. And if one of those legs of the stool is not holding up their end of the bargain, then the stool can't stand, right? So I think that building relationships with your vendor partners is really key. And then the last thing I would say is building trust with your physicians, especially in telehealth. I mean, they have to trust that you're going to provide them with a solution that's usable, or they're not going to give you their time and their talent and their input.
Yeah, and those last two intertwine in an interesting way. I mean, you shared a couple different examples where the collaboration between Oracle, Cerner, and Amwell solved some significant problems that were probably killing your trust with the provider organization.
Yes.
If they had to do the intake, if they had to document separately, et cetera. Is that kind of how you approach it?
Absolutely. Absolutely. The doctors knew that, hey, I know Linda's going to take care of this. We're not going to go live with a problem that doesn't work. And I know the Amwell and Cerner team have heard from us multiple times on that. It's like, look, we're going to wait until we can enhance this warm handoff workflow we talked about, for example. And we did wait. And then when we brought it live, it was much more acceptable to them.
Yeah. Well, I think with all the physicians burnt out, that trust is so important. So that's interesting.
Yeah.
Maybe one other question. I think a lot of people looking at rural may have some questions. And, what's it like being the CIO at a rural organization versus maybe some of the larger ones?
Well, I have worked, I've not been a CIO at other organizations, but I've worked at larger organizations, some very large ones. And so I know firsthand what that's like. But for me, there's a passion behind it because it feels like you're at a family organization. When you walk the halls of a rural organization, everybody knows everybody and everybody says hello. And from that perspective, the culture is just amazing. From technology and CIO perspective, we have the ability to make decisions, make them quickly, and turn much more quickly, to turn the Titanic much more quickly than we could otherwise at a large organization, because we have a little bit more control. Which is lovely. The challenges, however, on the other time, of course, there's limited resources. Financially, that's probably the biggest challenge for any rural hospital. We don't have deep pockets. So we have to be very careful how we spend our dollars, very careful where we put our initiatives and our resources, because they're limited. And hiring is a huge challenge in a rural environment. So I'm actually kind of blessed. And I know this sounds strange, but I'm very blessed that COVID came along, because it made remote work and telehealth and these kind of situations that we're having right here much more acceptable than it was in the past.
Yeah,
that's made a difference for us.
That's interesting. It opened up the hiring in a way that maybe your executives would be like, well, if they aren't devoted to the rural, then or something like that, I imagine.
Yeah, we hired our first person out of state that was 100% remote working for us, which was never thought of before. So it was a nice opportunity to keep our staffing levels appropriate.
Awesome. Well, Linda, this was insightful, and I loved hearing your perspectives and your experience and the evolution of telehealth, which I think we all needed to make it a better experience. So thanks so much for sharing, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting application. Thanks, Linda.
Thank you.